Did you know that migraine disease is the third most common in the world? Or that 12% of adults in the US battle these attacks? Aimovig is a treatment for patients who suffer from migraines and are looking for relief. Although temporary, the Aimovig injection is extremely effective. In your body, you have CGRP, which stands for calcitonin gene-related peptide. These proteins are released in the brain and it is believed to be the cause for migraines. The CGRP have receptors, or things that receive the information, and when the CGRP attaches, it activates the receptor. This activation causes inflammation in the brain, and the Aimovig injection blocks the receptors from the inflammation happening. Commissioner Office of the FDA approved this preventative treatment for migraines. Reports show that from the U.S. Food and Drug Administration, Aimovig is the first and only migraine treatment designed to block the CGRP receptor approved by the FDA. This treatment is so beneficial to every migraine patient and is a revolutionary development in medical advancement. Reported from Migraine Statistics, Facts and Data About Migraines on migraine.com, over 38 million Americans suffer from migraine disease, and 4 million of them battle with chronic migraine symptoms. Patients with migraines experience 1 or 2 migraines per month, although chronic migraine patients have 15 migraine days or more per month. A migraine day is a day out of the month you have a headache, but not a migraine. To be diagnosed with a chronic migraine symptoms, you must have 8 or more of these 15 migraine days be an actual migraine itself. According to Migraine Statistics, Facts and Data About Migraines on migraine.com as well, patients describe migraine pains as an intense pulsing or throbbing pain in one area of the head. Symptoms include nausea, vomiting, sensitivity to light and sound. 9 out of 10 people with migraines cannot function normally during the attack, and 1 in 5 could very possibly become disabled. The U.S. National Library of Medicine states migraines are partly caused to genetics, and it usually runs in the family. If one of your parents suffers from migraine disease, that gives you a 50% chance likelihood of also having migraine symptoms. There are also a number of factors that can trigger a migraine. It can be a certain smell, the brightness of a light bulb, or even as simple as weather change. These factors vary from person to person, although, and are good things to know at the early stages of migraine disease. Studies show on Aimovig.com that 40% of the people who are taking Aimovig decrease the number of days they get migraines by 50%. A placebo, when used in the same study, has only reduced the migraine days by 24%. Migraines are classified by 2 types of migraines: chronic migraines and episodic migraines. A chronic migraine is defined as 15 or more headache days per month, where at least 8 of the 15 migraine days are actual migraines themselves. Episodic migraines are defined as 4 to 14 migraine days per month, where 6 of them are actual migraines itself. Migraines are a problem that can debilitate a person experiencing it, and this treatment can give back the time lost to those agonizing headaches. The FDA shows on FDA.gov the effectiveness of Aimovig for the treatment of migraines. Aimovig was evaluated in 3 clinical trials. The first trial had 955 participants with a history of episodic migraines and compared Aimovig to a placebo. Over the 6-month trial, Aimovig treated patients experienced, on average, 1 to 2 less monthly migraine days than those on a placebo. The second study included 577 patients with a history of episodic migraines, and also were comparing Aimovig to a placebo. In this study, the trial took place over the course of 3 months, and Aimovig treated patients experienced on average 1 fewer migraine days per month than those on a placebo. The third study evaluated 667 participants with a history of chronic migraines, continuing to compare Aimovig to a placebo. In the study, taking place over a 3-month period, patients treated with Aimovig experienced 2 to 3 fewer monthly migraine days than those receiving a placebo. Allergic reactions, including rash or swelling, can happen after receiving Aimovig. This can happen within hours or days after the injection. From the clinical studies, the main complaint of the patients was redness and irritation around the injection site, although the itchy rash dissipated within 48 hours. Aimovig is a drug that has taken a huge step towards learning and understanding the science behind migraines and how CGRP receptors release that protein that cause the migraine attacks. Aimovig is a drug that can reduce the monthly migraine days by up to 50% and can help both episodic and chronic migraines. This drug I feel would help my dad greatly. He's a person who sometimes suffers with migraines, although he may get 3 to 4 headache or monthly migraine days per month. I feel that it could still help him because all he does when he gets migraines is just rest and endure the pain. This shot can greatly decrease the number of migraines in the patient and is a revolutionary invention that will bring back the life from those who are suffering.